Are you someone that is considering having foot and ankle surgery or someone that has just had it and recovering? Then this video is for you, because I'm going to tell you tips that you need to know to get better after surgery faster. Everybody, it's me, Dr. Nooreen. Welcome back to my channel. I hope everybody is doing well, and today we are going to be talking about how to recover from foot and ankle surgery, the things you can do to make sure you are set up for success and that you recover from your surgery as fast as you can and have the least amount of pain as possible. And if you guys have watched my other videos, you might know that I have had foot surgery before, twice. So I definitely know what I'm talking about from both perspectives. A lot of these things I did myself, and it definitely helps you recover and helps your pain diminish faster and helps you get back to your daily activities and get back to the activities that you want to do. All right, you guys, so now there's things you can do to set yourself up for success and the best possible recovery process before surgery and after surgery. So I'm going to split it into content between those two. So first, we're going to talk about the things you can do before surgery to make sure you have the best recovery process that you possibly can. All right, you guys, tip number 1, be as informed as you possibly can about the surgery you're going to have. A lot of times when you're scheduled for surgery, your surgeon will give you a handout with instructions, descriptions of what's going to happen, and just information about the surgery itself and the recovery process. Now, if you're given handouts, read them at home, write down all your questions, and then call the doctor's office or go make another appointment and ask them those questions. Be as informed as you can be about your surgery, about what's happening, about why it's happening, and what is your recovery process going to be like. Will you be non-weight bearing? Will you be partial weight bearing? Are you going to use crutches? Are you going to have a wheelchair? Are you going to use a knee scooter? Are you going to be admitted to the hospital, or will you go home the same day? There's a lot of things to consider when you're going to have foot and ankle surgery. Make sure you have a clear idea of what is going to happen. So just be as well informed as you can be about the procedure, because the more knowledge you have, the better you can prepare yourself to recover. Tip number 2, get your house ready for recovery. So for example, if you live in a house and your bedroom is upstairs, you want to try to temporarily set up a bedroom space for you on the first floor, because having to go up and down those stairs, especially those first 2 weeks of recovery, being in a cast or a cambu with crutches, a walker and whatnot, is going to be very difficult and putting your body through more stress than is necessary. So definitely set up something maybe in your living room or whatever space you have somewhere on the first floor where that can be your temporary bedroom and where that's where you're going to sleep temporarily for at least the first 2 to 3 weeks. The other thing you want to consider is having something for your shower to assist you with showering, because you're probably going to be told to keep your dressing clean, dry, and intact, and you can't get it wet. So you're going to have to figure out a way where you can sit down and take a shower, maybe even stick your foot out of the shower. For me, when I had my foot and ankle surgery, my brother-in-law made me kind of a stool for me to use when I was in the bathroom. He made it like custom to the size of the bathtub that I had, and I would sit down in there, hobble on my crutches, sit down, put my crutches to the side. I put a trash bag over my foot that had the surgery, and I would stick that foot out of the shower and then shower that way. The other thing you want to consider is the way my shower was oriented and the leg that I had surgery on. So the shower head was like behind me, which makes it a little bit more difficult to take a shower, which leads me into my third tip, which is get help. So you guys, I highly recommend that you arrange family or friends to either live with you for the first 2 weeks, or if you already live with family, that's great, have them help you. But if you live alone, try to have someone stop by your house once a day to check in on you, make sure you're doing okay, and that will make your recovery process much easier, because it is very hard to prepare your own food, to do kind of basic things when you're on crutches, you're in pain, and things like that. So consider getting help. And potentially, if it's someone you feel comfortable with, maybe that person can help you also take a shower, or at least help you set up the shower so that they can then step out and it'll be easier for you to take a shower. Tip number 4, you guys, get your groceries and meal prepared for at least the first 2 weeks after surgery, where you won't have to worry about cooking or about having food food ready for you, especially if you live alone. I highly recommend doing that because it's going to be very hard to cook or, set up meals when you're recovering, you're in pain, and you have to use assistive devices. Now, if you live with your family, make sure someone is there that can prepare the food, or if you are the usual meal preparer or the usual cook of the family, make sure you have someone in your family that can kind of step into that role while you recover, or use Instacart or Uber Eats or something, but just figure out your meals, okay guys? So my tip number 6 is don't smoke. If you're a smoker, please stop smoking for as long as you can before and after surgery. Nicotine inhibits your body's ability to heal. And when you have surgery, that is trauma that you're inflicting on your body, and your body has to heal. And if you're a smoker, all you're doing is hurting yourself. So if you're a smoker, please stop smoking, or at least cut it down as much as you can, because that'll just help your body heal and recover better and faster, and it will also decrease your chances of having more post-op complications. So tip number 6, if you're diabetic, make sure your A1C is below 7. If you're a diabetic having elective surgery, make sure your A1C is below 7. Again, you want to set yourself up for success. If your A1C is really high, it's going to impede your body from healing. It's going to make it more difficult for your body to heal because of those high sugar levels in your blood system. For me personally, if I'm doing an elective procedure on a diabetic, I want the A1C to be below 7. However, that can vary from physician to physician. So if you are diabetic, if you know your A1C is higher, definitely talk to your physician about that. And I'm sure they'll have the conversation with you before you even bring it up about where your A1C level needs to be before it's safe for you to proceed with elective surgery. All right, you guys, so now we're gonna go into my tips of how to make sure you heal and you have the best recovery possible after surgery. So the following tips are things you do after you've already had surgery. The first tip is make sure you have a ride home, because you might be in pain, you're gonna be groggy, so you need to make sure that you have someone that can drive you home. Tip number 2, you guys, take your pain medications right away. So usually the surgeon will give you your pain prescription right before surgery. If you have family there with you or a friend, have them go fill that prescription while you're in surgery, or if that's not an option for you, fill that prescription on your way home so that you have access to those pain medications as soon as possible. Like I said in the video where I talk about my own surgery, I highly recommend that you guys start taking your pain medications scheduled every 4 to 6 hours for the first 2 to 3 days on a regular basis. Because sometimes when you wake up from surgery, you're going to be numb because the surgeon will put numbing medication in your foot, so you're not going to feel pain, and you might think, well, I'm not having pain, why am I going to take this pain medication? But the thing is that local anesthetic that they put in your foot is going to wear off, and once that wears off, you will feel pain. And the key thing is you want to control that pain before it starts, because if you try to take pain medication after that pain kicks in, you're now chasing that pain, and it's going to be much harder to get that pain under control. So for those first 2 to 4 days, set an alarm even in the middle of the night to take your medication every 4 to 6 hours as prescribed, and after 2 to 4 days, see where your pain level is at. If you feel like your pain is controlled, definitely start weaning off. And kind of intertwined into tip number 3 is opioid pain medication can make you constipated, so that's definitely something to look out for. So when you go fill that prescription, also grab a stool softener and take that with the opioids. Now, not everyone will have constipation, but it is a very common side effect. Tip number 3 is ice. Ice. So you guys, you have to make sure that you're icing post-operatively. Ice is going to help decrease the inflammation, and it's going to help decrease the temperature of the blood traveling to your foot to help cool down the entire area and help really control that pain. Now, you can put an ice pack on top of your foot and behind your knee, and you might be thinking, why the heck would I put it behind my knee? I didn't have surgery there. But the blood flow that goes to your foot, it travels behind your knee. So you're cooling it down behind your knee heat as it goes towards your foot, and you're also trying to cool it down on your foot itself. And I will post up a picture of me doing that after my surgery as well. And you want to ice for 10 to 15 minutes and then take it off, and then give your body a break for 10 to 20 minutes and then put it back on. All right, you guys, so tip number 4, make sure that you are also elevating your foot. You want to make sure that you're elevating above the level of your heart, which means that when your foot is elevated, if you're laying flat down, it's literally above the level of your heart. The other thing you want to make sure you're doing is when you are elevating, put a few pillows under your foot, but make sure there's not too much pressure on your heel, because that can be something people complain about, is heel pain after surgery, because they are elevating, they are icing. But with laying down for that long period of a time and your foot being elevated, sometimes that pillow, those stack of pillows and the cast or the cam boot, whatever you have on, that pressure contact can put a lot of pressure on your heel. So just make sure that when you're elevating, your heel is offloaded or kind of floating, which I will show you guys what that means. And you guys, you want to do tips 2 through 4 regularly, especially those first 2 weeks. It'll be so important and making sure you have the best recovery that you possibly can. Okay, I briefly touched on this next tip before. Tip number 5 is leave your dressing alone. Keep your dressing clean, dry, and intact. And if you see a little bit of blood on the dressing, a little bit of blood is okay. But if you feel like there's an excessive amount of blood and you're concerned, definitely go ahead and call your doctor's office, and you might have to go in and see them. But if you have any questions or concerns, call your doctor's office at any time, especially post-operatively. But leave your dressing alone and don't get it wet. Don't take it off. Guys, tip number 6 is don't get your dressing wet. So I kind of touched on this before in my before section of tips, but you want to make sure that that shower is set up and that foot is not getting wet. And if you accidentally do get water on it, definitely call your doctor's office right away. Tip number 7, look out for calf pain. So you guys, if you're having calf pain or your calf is red, hot, or swollen, definitely call your doctor's office or go to the ER, because that could be a sign of a DVT, which is very serious and needs to be addressed. However, if you have had surgery or something done in your calf, like a gastrosoleus recession, that pain could be due to that surgical procedure. So if that pain kind of matches the pain in your foot, it's likely nothing to be concerned about. But if you feel like your calf pain is excruciating, it's out of control, and maybe you also feel like it's red hot or swollen, then definitely give your doctor's office a call. Tip number 8, post-operative exercises that you can do. So you guys, this next tip is for after your first 4 to 2 weeks, once that pain is under control and you feel steady with what you're doing. The exercises that I'm going to show you guys, none of them put weight on your legs, and these are things you can do laying down that will help keep your blood flowing and will help decrease the amount of muscle atrophy you're going to get. And muscle atrophy is basically when you lose muscle mass because of not using your muscles. And when you have surgery, unfortunately, you're just not using that leg because you have to stay off of it for a little bit, but that also means you're not using those muscles, so those muscles do atrophy. So these next couple of exercises that I'm going to show you are completely okay to do, and you can start them as soon as you feel comfortable and able to do so. So the first one is going to be moving your leg up and down as a unit from your hip. The second one is going to be moving your leg at your knee. So moving your leg back and forth at your knee. And then the third one is going to be laying on your side and moving that leg up and down from your side. So you're going to be abducting and adducting your leg at your hip. Tip number 9, add an orthotic to your cam boot. You guys, after surgery, you're likely going to be in a post-op splint or a cast, which will then get switched out at post-op week 1 or 2 into either another cast or a cam boot or post-op shoe. It depends on what your surgery is and what your surgeon's specific preferences are. But my advice to you would be, when you eventually go into a cam boot or a post-op shoe, to add an orthotic to it, because the insoles of those cam boots and post-op shoes are completely flat, and it can be very uncomfortable to walk in those, especially when you're just starting to put weight on your foot again, when it's already uncomfortable to do that. And feels a little weird, to be honest, when you start putting weight on your foot again after not having putting weight on it for a little bit. And I'll show you guys what I'm talking about. So this is my cam boot from after surgery, and what I have is this insert. It's very flat. There's no support in there whatsoever. So what you do is you take an insert like this. This is very soft. It's very cushiony, right? It's very bendable. It's not really, doesn't have that much support. It has a little bit of an arch built in, but most of this is literally just cushion. And putting in something like this into your cam boot after surgery or your post-op shoe can help make your foot a lot more comfortable. Tip number 10, use an even up. What the heck is an even up, right? So what happens, you guys, is if you look at this cam boot, it's super thick on the bottom and it adds a lot more height to the leg that you're wearing it on. If you're someone who has hip pain or low back pain, wearing a cam boot for a long period of time can add to that hip or low back pain. So something that I would recommend, especially if you're gonna be in a cam boot for more than 2 weeks, is using something called an even up. And this is, I use both of these on after my surgery. So I had this cam boot on my left foot, and then I put this thing called an even up on my right normal gym shoe. What an even up basically does is exactly what it says in its name. It evens you up, because that cam boot is going to make that leg that it's on a little bit longer and make the leg that didn't have surgery a little bit shorter. So when you're walking, your hips and your low back are going to be off, and after a little bit of time they can be painful. So an even up literally puts your non-operative leg at the same level as your operative leg. And this is my even up. I use this, I put it on my shoe. It is totally worth the investment because it will make sure that you're even when you're walking, and it'll help you to not develop that hip or low back pain. Now I used this on my second surgery, which helped a lot. I didn't get that hip pain. I did not use this on my first surgery, which I really wish I had, because after my first surgery I was in a cam boot for a total of 3 months, and about into 2 months into wearing that cam boot, my hips were killing me. My med school was also comboed with DOs, which are doctors of osteopathic manual manipulation. So they learn how to manipulate your soft tissues and stuff like that. So I actually had one of my DO friends OMM my hips, and that helped kind of put my hips back in place. So I highly recommend using an even up, because it could save you from potentially having hip or low back pain if you have to use a cam boot. And you guys, those are my tips for having a successful recovery and the fastest path to get you back to doing the activities that you want to do. All right, you guys, thanks so much for watching. Don't forget to stretch and subscribe. Like this video and leave a comment down below if any questions or concerns you may have if you're gonna have surgery. See you guys next week.